Good evening and welcome. We'll give it a moment for folks to log in and find their way into tonight's presentation. And while we're doing that, I want to let you all know about a special election series that the Division of Social Sciences at PLU has been doing over the course of the semester. They've had panels and speakers talking about different aspects of the election. They have an event on Thursday related to the Washington State Lieutenant Governor's debate. So I encourage you to go to the PLU Division of Social Sciences website, and you'll see a link to the election series. And all of the events have been recorded, so if you missed a previous event, you can watch the recording. It's really been a great resource for the PLU community. So if you haven't seen that yet, please check it out.
Thank you, Teresa, for reminding us all about that. I've been really enjoying the series myself. I think we'll start with our presentation tonight, and it's my great pleasure to introduce our two lectures. We have another combo collaboration this evening from the PLU's philosophy department. So it's my great pleasure to introduce Sergia Hay and Paul Menzel, and I'll say a few words about them. Sergia is Associate Professor of Philosophy and Director of the Wild Hope Center for Vocation, and she's taught at PLU since 2011. She teaches courses in applied ethics, that means biomedical ethics, environmental ethics, and business ethics, and the history of philosophy. And her book, Ethical Silence, Kierkegaard and Communication, Education and Humility, is forthcoming with Lexington Books this year. So congratulations on that, Sergia, and welcome.
Thank you.
Paul Menzel is Professor of Philosophy Emeritus, and I'm especially happy to introduce Paul because he hired me as Dean of Humanities 25 years ago, and then subsequently became our provost. So we're very excited to have you be part of this series, Paul. And Paul is also a leading world thinker in philosophy on medical ethics. So we're really, really privileged to have him be part of this presentation. Paul has published widely on moral questions in health economics and health policy, including his book, Prevention versus Treatment, What's the Right Balance? Which is published by Oxford University Press in 2011. And I went on Amazon today. There's only one copy left for now. So there you go. He's currently working as a member of several national projects in biomedical ethics and publishes frequently on various end-of-life issues. So there's no one better suited to the topic of COVID-19. Welcome, both of you, and thank you for being here.
Thank you very much, Tamara. Thank you so much for having us. Paul and I are really glad to be part of this course, and we've appreciated learning from our colleagues at PLU. Thanks so much for this opportunity. I'd also like to say what a pleasure and an honor it's been to work with Paul. As already noted, he's a well-respected scholar in the field of biomedical ethics and a beloved longtime PLU philosophy faculty member and administrator. And he's just a genuinely lovely person who makes a mean plate of pasta with mussels. So that's him too. So tonight, Paul and I are talking about ethical decision-making during a pandemic, and we will be using the discipline of philosophy to do so. I will begin by introducing you a little bit to the discipline and describe some of the tools that we use, and then Paul will show how these tools can apply to a particular ethical issue raised in the pandemic. So slide, if you could progress, thank you. Ethics is one branch of many in philosophy. The discipline also ranges across a whole variety of issues, such as the limits of knowledge, the purposes and nature of art, and justifications and principles of systems of government and economies. Next slide, please. So ethics is the study of values that govern our character and relationships. These relationships include those we have with others, with our own selves, as well as other organisms and elements of our environment. Ethics involves terms like right, wrong, good, bad, fair, unfair, just, unjust, responsible, and irresponsible. Ethics is what we call a normative enterprise that is not just interested in what is the case, but furthermore, what should be the case. The late Honorable John Lewis, who represented Georgia's 5th Congressional District in the United States House of Representatives for 33 years before his death earlier this year, studied theology and philosophy because, as he stated, by studying these subjects, he found the underpinnings for what he'd sensed and deeply felt his whole life, that there was a contradiction between what was and what ought to be. Working out what ought to be is at the heart of doing ethics. In order to do this creative imagining, we can employ tools like moral theories, which articulate or amplify moral intuitions so that we can better examine them. Moral theories help us understand the foundations of ethical judgment and establish frameworks to evaluate actions. Before we talk about 2 moral theories, it's important to note that we are engaged in ethical thinking all the time on small and large scales. Should I do my homework? Should I be honest about how I feel? Do I need to share my chocolate stash? All of these kinds of questions have ethical import. Next slide, please. On a larger scale, the pandemic is raising a whole host of ethical questions such as these. How can our health system be more just? We know some populations of people are suffering from COVID more than others, as well as different access to appropriate health care, as Professor Crawford O'Brien's presentation clearly showed last week. We can also ask, what should society's role in minimizing caregiver suffering be? What are our duties to the natural world and animals if they play a role in the spread of disease? And what is the obligation of medical providers to disclose the truth? So let's take a quick minute to just do a quick activity. Paul, if you could just go back to that last slide. In the chat, please post some ethical questions that you think are raised by the pandemic. So we'll just take a second here for you guys to think about what kinds of questions do you think have been raised during the pandemic that have an ethical nature. Great. So what I'm seeing here is who will have first access to the vaccine, who should receive medical care and testing, what is the role of the government, supply chain issues, great. Why do I have to wear a mask? Should families be compensated when schools are closed? Can family visit others who are dying from COVID? The issues having to do with different impacts on different groups. Will I receive care? Should relief programs include populations that are not legally authorized in the country? What's happening as we're discounting the lives of older people? This is wonderful. Should it be mandated that people receive a vaccine? Can people be forcefully quarantined? So we'll be looking at some of these questions in our presentation. That's great. I appreciate your participation there. That was a way to get our ethical juices started. So thank you very much. Okay, so in thinking about all of this, Paul and I identified some groupings of ethical questions based on some consistency and fundamental tensions between some important values. So for example, there are a variety of questions that come up, as you have noted in the chat, because of the collision between limited resources, which can include things like money, staff, equipment, treatments, an increasing need or even global need, as in the case of vaccines. So some of these types of questions would include who should receive priority if there are a limited number of respirators available? Should I donate my N95 mask to healthcare workers, or should I keep it for myself? And who should pay for vaccine research and production? So some of you asked questions about the role of the government, and so that would be relevant here. Okay, if you could progress the slides, please, Paul. Okay, another grouping of questions arise from the tension between our desire to follow patient will and caregivers' need to act, sometimes in situations when patient will cannot be clarified. to the extent that we want it to be. So some types of these questions would include who should make end-of-life decisions when emergency time or lack of decision-making capacity prevents discussion with the patient, or when clinicians can't reach the patient's healthcare agent or proxy, and then what criteria should be used to make these decisions. So these are really important questions even outside of a pandemic, but they certainly get highlighted when we're dealing with large volumes of patients who suddenly become ill and are subsequently separated from family members for treatment. Okay, another category of questions, which will be the focus for the rest of this talk, are these. These questions come up when we juxtapose individual and group interests. These questions include topics of mask wearing, following stay-at-home orders, following quarantine instructions, vaccine compliance, and also, interestingly, participating in challenge trials. In the last 48 hours, there's been a lot of press about a challenge trial planned by the Imperial College London, and so I recommend that you read the articles about that if you're interested in those. So now that we have some questions to examine, we need to assemble some tools in order to discuss them. So we're going to take a look at two different moral theories. The two moral theories that we'll introduce have very different ideas about what matters most to ethical evaluation. One theory believes that actions should be judged on intentions or motivations that inspire action, while the other theory believes that actions should be judged on the consequences or the outcomes they produce. Because of these very different angles of evaluation, sometimes these theories produce different answers to the question of what we are to do. So I will say more about that in a minute. So we'll proceed on with our next slide. So the first theory, utilitarianism, is what we call a consequentialist moral theory. This is the one that says that consequences of actions matter the most. We will know if an action is the correct thing to do, a utilitarian says, if it promotes the greatest possible total amount of happiness and conversely produces the least amount of suffering for all those affected. According to utilitarianism, all those affected can go beyond you, your friends and family, to all those touched by the consequences of the action. For many contemporary utilitarians, this also includes consideration of animal life, which is affected because they too can experience pain and pleasure. Next slide, please. The second theory that we're looking at is a non-consequentialist moral theory that evaluates actions on whether or not they conform to moral rules and duties. This theory, called Kantian ethics, named after the philosopher Immanuel Kant, also known as deontology, is based on the idea that there are some ethical truths that apply to all. These truths are called the universalization and respect for persons principles. The principle of universalization states that an action is ethical if you can will for it to be the case that all others could act in the same way you are doing for the same reasons. This rules out the kind of ethical bargaining that we do sometimes when we say things like, this rule doesn't apply to me because of these circumstances, or it's an okay to make an exception this time because whatever justification you provide. The respect for persons principle states that we should always treat people, other people, and our own selves as subjects of dignity and infinite worth, and not use them or ourselves as a mere means to get something we want. So as you can see, these theories are really different, and sometimes they provide us with different answers to challenging ethical questions. Next slide, please. So they provide different answers to questions like this. So a question like, what is the obligation of medical providers to tell painful truths? A utilitarian would work out an answer based on a prediction of outcomes. If a truth would bring about the greatest amount of happiness and the least amount of suffering, then it should be told. But if it doesn't do this, a utilitarian could claim that it may be justifiable to withhold or conceal painful truths. On the other hand, a Kantian would say we have an overriding duty to tell truths, painful or not, because it would be very difficult to will a world in which painful truths would always be concealed. A Kantian would also ask if we are simply using people in this case to make ourselves or to make them feel better, rather than respecting their worth as dignified, rational agents who can make their own decisions about what to do with that information. So at this point, I will turn the presentation over to Paul.
I'm very glad to be here. It's a joy to work with not only this class, but Sergia Hay in particular. Rights, individual rights. That will be the focus of a considerable amount of our subsequent discussion. The two basic kinds of individual rights, these are rights that protect individuals. One kind is liberty rights. Sometimes they're called negative rights. They're rights that protect a person from being interfered with by somebody else. A very different kind of right is what is sometimes called positive rights, or rights to be provided certain basic goods. For example, John Stuart Mill argued that public education, K through 12 public education, was an individual positive right. Every individual needed that to thrive in the society. Now, does recognizing a right minimize harm and enhance total well-being more than not recognizing it? That's the question utilitarians ask. You allege that there's a certain individual right, whether it's a liberty right or a right to be provided certain basic goods, and then you ask, does recognizing that right minimize the total harm and enhance total well-being more than not recognizing it? And notice that minimizing harm and enhancing pleasure or utility or happiness is always a net business. That's why we sometimes talk about enhancing net total well-being, the positive minus the negative. Does recognizing the right do that, or does it not? And you also can't just look for a moment. You have to look sort of long-term at this, because we don't have rights to protect people just at a particular moment. When a person has a right, it protects them for a long time, and it protects a lot of people, or all people. Practices creating greater overall well-being of the liberty rights sorts are rights to free speech. John Stuart Mill argued that, in fact, if you don't have rights to free speech, you so dent the truth, and truth is and free debate is valuable, so valuable in a society that the society devolves into a lower level of aggregate well-being. Rights not to be interfered with one's primarily self-affecting choices, for example. He also argued paternalism. If you are paternalistic toward other people generally, what you're going to end up doing is making your judgments about their well-being, when the fundamental judgment about a person's well-being is a subjective judgment about them, about what their well-being is. Now, sometimes they can go wrong, to be sure, and there are exceptions to this. Rights in Kantian ethics have a very different basis. It's not the question of whether recognizing the right in the long run creates that total aggregate well-being. It's two questions. The universalization emphasis is that Sergia explained in Kant is transparently a fairness question. Can I will that all others have a similar right? If I claim a right to free speech, and I can describe it in certain ways, it doesn't have to be absolute and with no boundaries at all. But whatever the right is that I claim is my right, and you should not interfere with, the society should not interfere with, can every other person have that right also? If I am not willing to see every other person have that right, then I'm unfairly carving out an exception for myself, just fundamentally unfair. John Rawls, a contemporary Kantian, has put this by maximal liberty compatible with like liberty for all. A second ground is respect for individual persons. Is the right needed to treat persons with dignity as ends in themselves, as people who are agents, who are rational, can think, and never not treating them merely as a means to achieve my ends or even other people's ends? This is called the dignity respecting basis, individual dignity. If I say that people don't have a right to free speech, I'm not treating them as citizen agents in the society. If I don't give them a right to vote, I'm not treating them as agents in the society. I'm treating them merely as a means to my group of people having the right to vote and then being able to use them by ignoring them. Both justifications yield both negative rights, for example, to political participation, or to free speech, and positive rights to political participation, to universal basic education, and various other rights that one can argue. Now, one aspect of unfairness, and remember the fundamental driving principle here is respect for other individuals with their dignity, and the universalization requirement makes it particularly obvious that fairness is the foundation of Kantian ethics. And one of the very important fairness principles concerns free riding. And the free riding principle, or the anti-free riding principle, talks about the unfairness of free riding. This is fundamentally about fairness. It's not an argument about results. And to grasp it, you need to have a concept in hand. Namely, it's one version of public goods. There are different kinds of public goods, but the one that's most relevant to public health here, or at least one of the most relevant, is this particular kind of public good. It's a good that benefits everyone, that is, everyone receives the benefit from a collective enterprise, even if they do not contribute to it. The principles fundamentally are elements of this principle. If we read the whole principle, it would be a person should pay her fair share of the costs. Cost is interpreted very broadly, including time, sacrifice, and inconvenience, not just monetary costs, of a collective enterprise that produces benefits from which she cannot be feasibly excluded. She's going to get them anyhow. If she refuses to contribute her fair share, then she may be required to, not just left up to whether she voluntarily contributes them. The key elements here are it must be a collective enterprise. Secondly, it must produce benefits from which she cannot be feasibly excluded. She should pay her fair share of the cost of the collective enterprise in producing those benefits. It's not just any share. It doesn't necessarily have to be an equal share. It needs to be a fair share. Some people's share may fairly be less than other people's fair share. If she refuses to contribute, we may simply require her to contribute. Now, this is sometimes, well, in public health, we see some very obvious applications of this. Take air pollution. I say, but my not complying by buying really efficient cars, for example, that is relatively non-polluting, less polluting cars, won't make any real difference. Because, at the margin, if a lot of people buy high mileage cars, then I get the benefits of reduced air pollution. And my little bit by driving a very hot, low mileage car, let's assume it is a more polluting car, not just because of mileage, but maybe some other thing. Or I buy a cheaper car because it's got less refined emission controls. That's not at the margin going to hurt anything. We're still going to get the basic freedom from highly polluted air. Now, that just is not a defense, because it doesn't get at the fairness element. I'm getting the benefits anyhow, but I'm not sharing in the cost. Now, sometimes the solution to this is not simply to directly require me to buy a high mileage car, It perhaps is indirect, what economists might call indirect here. Namely, we make the auto industry abide by mile per gallon fleet standards. So all of GM cars or all of Ford cars have to reach a certain mileage standard. And then that is foisted on everybody because everybody buys cars then from those fleets. And the result of that may well be that I have to pay more for my high mileage car because of the general cost of everybody having these higher mileage cars. I might pay more for my low mileage car or my high mileage car than would if we didn't have the fleet standards. The argument can get pretty complicated here, but the point is you don't always make a person comply by a direct requirement on their behavior. You can sometimes do it in an indirect way. And they're still paying their fair share because they have to pay more for the resulting high mile per gallon fleet standard cars. The second example would be vaccination and herd immunity. You achieve herd immunity, and we'll talk about that more later, let's say by 80% of the population being immune to the disease from either vaccination or the natural spread of the disease, which creates its own so-called natural immunities. When you reach 80%, it doesn't matter whether the remaining 20% abide by the restrictions or not. I still get the benefits, but I don't have to comply because my compliance, I might argue, doesn't really destroy the benefits to all the people who are willing to pay for the benefits. But that's no defense because it's still unfair for me not to pay my share when there is this collective enterprise from which I get benefits from which I cannot be excluded. Fairness is the core problem, even when marginal non-participation doesn't destroy effectiveness at all. Now, we see examples of this in mask wearing. It's unfair for some to gain the benefits of others' mask wearing without doing it themselves. Mask wearing is a cost. It's inconvenient. I may not want to do it. Other people around me may not particularly like it. They can't hear me as well, whatever. But if other people are wearing masks to reduce my chance of infection, and I get those benefits whether I wear a mask or not, that's fundamentally unfair. Social distancing is the same thing. If people social distance then, and I don't, I still get the benefits of their social distancing as long as we've met that sort of critical mass of people who are social distancing. Vaccine compliance. Benefits come even to those who don't vaccinate once herd immunity is achieved. We'll talk more about herd immunity in a bit. All three have a role in achieving, no one thing about herd immunity right away. In achieving herd immunity, some people talk about the natural immunity from the spread of the disease plus immunity created by vaccination. There is also a kind of additional social component to herd immunity. If we combine the natural immunity from spread of the disease with vaccination-created immunity, and then add to it the extra capacity for the lack of capacity for the disease to spread, including spread to me, by the fact that lots of people are wearing masks and lots of people are social distancing, then we get a kind of combination of natural plus vaccine created immunity plus this socially created herd immunity. Some people don't call that the herd immunity, but in a certain functional sense it is. And I would argue that all three have a role in achieving functional COVID herd immunity. Now, herd immunity is quite disease specific. Some diseases may have achieved herd immunity at 60% because there just isn't enough residue left in which they can spread because they're not extremely contagious. COVID probably has an immunity somewhere between some people are saying it's as low as 60. I doubt that when you read the studies. It may be as high as 80, 85. Measles, by the way, is about 90. It's so contagious that you need that amount of immunity in the society to get herd immunity, where It doesn't matter whether to the effectiveness, but whether the last 10% vaccinate. The full anti-free riding principle, however, is a little more complicated than the one I read at the beginning. It's unfair for people to get benefits from which they cannot be excluded without paying their fair share, et cetera, and they may be coerced into paying their fair share. The full principle says it's unfair, unless the person would actually prefer to lose all those benefits rather than pay your fair share. Okay, sounds fair. Suppose the benefits of herd immunity to me, they're not big enough for me to make paying my share worth it. And that's really what I believe. We might call these people honest holdouts. They're honest. They really, to them, the benefits just aren't worth the cost they would have to pay if they had to pay their fair share. How do we know whether an objector's resistance, however, is based on a genuine preference for losing all benefits rather than paying her fair share of costs, if she cannot actually be excluded from the benefits? She might claim it, but in fact, she might be making an inflated claim. She doesn't even really know herself whether it's worth it or not, because she's just thinking in terms of her own world. So we get back to perhaps enforcing the making the person pay anyhow. Now, a utilitarian view of the anti-free riding principle, or the unfairness of the anti-free riding principle, and the fundamental wrongness of free riding, we wouldn't call it unfairness, wrongness, would not call it the unfairness of free riding. It would call it collective protection. Many enterprises require participation of a large portion of people that they are for. For example, paying taxes. If a lot of people don't pay their taxes, the whole system of paying taxes for a collective enterprise is eroded. Many people argue that this is what's happened in Greece, where it's almost so many people don't pay their taxes, and look what happens in the result to the integrity of the government. Non-participation erodes others' incentive to participate. Maximum effectiveness and stability are achieved by universal requirements. So again, we can require people to participate in this collective protection, but we don't do it out of the unfairness of not participating, paying fair share, because we don't have a notion of fair share. We just do it on the basis of the ineffectiveness of a lot of sufficient number of people not paying and not participating. Now, this gets a little tricky here, because in this utilitarian view, it's what are the harms? If a harm is statistical, that is, I have a risk of getting the harm, and it's over a, say 4-year period, or it could be a 1-year period, but it's only a risk. So how do I see the harm of that? If I see it right now to a particular individual, either a friend, neighbor, or even a particular individual across the ocean, much less myself, I'm likely to see it as real harm. But if I see it only in this mass of statistical probability, it's hard for me to identify with it. It's hard for me to see it as a harm, and therefore hard to see non-participation as hurting anyone. This is simply a hard conceptual move for people to make, well borne out in empirical studies about people's perception of what are the harms that they have to fear. Now, one thing to note is that if the harm is merely statistical, that is, I have a risk of a certain relatively low risk of being harmed, and other people have a relatively low risk of being harmed. But if you look at the aggregate, the harm still is real consequences. In COVID, let's say an extra 100,000 people die. Now, it's only a statistical risk to me if people don't mask and et cetera, and social distance, but doggone it, those consequences happen to real people. Except we now see them as only a risk to people. So the consequentialist utilitarian will say the real consequences determine the matter here, and they're still just as important. Now, how do we get people to identify with it? Well, all you have to do is see yourself down the road as one of those people who might be a victim of the increased risk. And there are many, many examples of how people end up doing that. It can be because a neighbor got it or whatever. Issues about COVID. Why can't I just ask what the risk is, act on what the risk is to me? We've gone over that. That isn't the right question. The question is, what is the risk to others when I don't participate? That's both the fairness question and it's the effectiveness question in a collective enterprise in utilitarian. The risk to others is indeed harder for people to incorporate into their decisions than direct harm to others. Thus, the actual full risk to the society is difficult to see. And we see that alive and well in what people say about oh, I'm willing to take the risk. It's only a risk. And if I don't do the things that would reduce my risk. Facts, facts, facts. Reasonable disagreements about them, but standards of truth should be used. People don't just create their own factual claims. They don't know what a factual claim is if they think they can do that. There are indeed reasonable disagreements about what the facts are, but standards of truth have to be used. We might sort of get a meta principle about this in applied ethics. Doing good applied moral philosophy depends on facts and getting them right. There is no simple right to believe what I want. There is no right to ignorance. Okay, I don't care whether I'm knowledgeable or not. I feel fine with ignorance. Wait a minute. No, it's not good. It's not right to feel fine with ignorance. It just isn't. And you can say I should have the liberty to be ignorant, but you can't do good applied ethics if that's what you think. Sergia.
Thanks, Paul. So what is the upshot of all of this? Paul and I wanted to show that these two theories, which are very different from each other, can sometimes draw different conclusions on questions, like the one that I mentioned earlier about what is the obligation of medical providers to tell painful truths. For the questions of public health that we've considered, in which individual interests compete against the interests of the group, both of the theories that we've discussed arrive at the same conclusion, and they just use different reasons to do so. So Paul and I conclude that strong and persuasive ethical reasons can be provided for mask wearing, following stay-at-home orders, and vaccine compliance. And that has to do with these concepts having to do with aggregate benefit and fairness. And so we think that the answer here, ethically speaking, is really clear. It's interesting because when we were first considering these questions, because mask wearing has become a politically controversial issue, it seems like it's initially a problem having to do with freedom. But what we're trying to show is that it's really not, we don't have freedoms to make people sick. And so one of the questions that was on one of Paul's slide previously was, why can't I just act on what I think the risk is to me? I think a helpful question to consider there is whether or not there are really any genuinely self-regarding actions. In other words, actions that only affect me and no one else. And in this case, when we're talking about issues of public health that do have serious consequences for the whole group, we are certainly not talking about self-regarding actions. So thank you very much. And at this point, we'd like to open it up for conversation and questions and discussion, and we're looking forward to hearing what you have to say.
Teresa and I will be helping facilitate the questions. So it looks like we've got a question in the chat. This is from Thomas Mitchell. And the question is, how does justice fit into utilitarianism? Summing up effects would not always produce just results. So Teresa or Paul, would one of you be willing to take that question on?
Well, just a first cut at it. John Stuart Mill argued that justice, in fact, did have a role in utilitarianism, and a lot of other utilitarian ethicists have said things in the same vein. Why does paying attention to, for example, just equality and avoiding unjust inequalities create greater aggregate net well-being in the long run in society? There's considerable evidence, actually, that societies are more stable. They actually work better. Not only the people who are at the lower end of resources in the society, but people even at the higher end of resources in society are happier in a society with, let's take the US right now, with less extreme inequality. Now, exactly what balance of equality and inequality and how we define equality is still up for grabs in that, but the utilitarian point is, in the long run, and remember that's always the utilitarian focus, in the long run, the aggregate well-being in the society of all people in that society who are affected by just and unjust relationships will be maximized by relatively more just arrangements.
I would add, I think, one of the challenges of one form of utilitarianism, namely what we call act utilitarianism, makes it possible in some cases to overlook the rights of individuals if we're making a decision that benefits the whole. Because of this problem having to do with justice, some utilitarians have revised it to match what Paul is talking about. So this is called rule utilitarianism, when you have a long-term view about what the societal benefits are to having just systems in place, right, that don't allow the harms of individuals or the rights of individuals to be trumped in favor of the whole. So I think a distinction between two types of utilitarianism is helpful. And I think Paul is making a strong argument for the one that has a long run view of justice.
Thank you. So a question came in from Angela. How do you feel the UK challenge trials fit into the discussion of utilitarianism and Kantian considerations?
So can I go, Paul, and then you'll fill in my gaps? So this is a really interesting situation in which individuals are taking on risk personally in order to be able to test whether or not a vaccine is effective, right? So they are taking a vaccine, they are exposing themselves to the disease, right? And then they are being used as research subjects to figure out whether or not the vaccine is actually effective. So here you have a person that is making a decision that might actually end up with poor outcomes for themselves, right? It might end up having benefits for the whole, but it might be actually a very dangerous choice for the individual to take on. And so here you have, again, these competing interests between what's good for the individual and what's good for the group. What makes them challenge trials so ethically fraught in the case that we have right now is that there's no known treatment for COVID. And in some cases we have challenge trials where there is a treatment so people can receive that treatment. We also don't know what the long-term effects are or how it affects different groups of people. And so those kinds of unknown situations create even more risk for the individuals that are involved in these trials, which create ethical problems in joining them. So Paul, if you want to add anything.
Yes, the Kantian view on this is quite interesting and has some sort of strong variety within it. If you're treating a person with dignity, you're recognizing him as an agent who can make decisions according to their best judgment. And if a person's best judgment is, I'm altruistic enough that I want to volunteer for this trial, even if I don't know that I'm going to be safe in volunteering for it. I may die by volunteering for this. Regardless of those, my decision, my considered decision as an individual who can think about these questions, is that I should contribute this. Now, can I universalize that judgment? Can I say that anybody who's similarly motivated as I am to participate in a vaccine trial like this, should they be able to do it? Well, what would be wrong if everybody who did want to do it that way was allowed to do it? Now, they probably have too many applicants, but there would be. But it's not impossible for me to be willing that everybody else do what I'm doing. As many people who want to do it as I do. There's no contradiction there. Except some people then point out, well, wait a minute. Some people are going to get enticed. They think they're altruistic, but they don't really know. And they're going to be lured, and there's even going to be social pressure on them to volunteer for these trials. And that creates some distinct unfairness, namely people are being coerced instead of being treated as totally free individuals. And the inevitability of that pressure, that coercive pressure, some people think destroys the Kantian argument for being able to volunteer for these trials. It gets quite complicated from the Kantian view.
Great, so we have the next question from Aubrietta in our audience. And the question is, how do determining who gets use of limited supplies, such as ventilators and other medical supplies, to patients work in the context of these two ethical theories?
The utilitarian would say, it's sort of like the triage situation in military medicine. You need to do two things first. First of all, you need to prioritize the protections and the equipment, et cetera, the research for the people who are going to be helping other people to avoid the disasters. Frontline healthcare workers, absolutely the first. And that's true in military medicine, and it's true in the current, utilitarian is likely to say in the current situation. The second consideration is you allocate the resources that are scarce first to the people who can gain the most. Now, sometimes the people who can gain the most are not the ones who are in the most acute and emergency situation, because you can give the care to them all right. They're in greatest need now, but they might not gain much from it because they're going to die on the respirator or die when the respirator has to get removed anyhow because it isn't successful. Or they're going to have only a very short life after they get off the respirator. I mean, there are all these factors thrown in to a utilitarian's consideration here. You want to take a slice at the Kantian one?
I was just going to say, I think that's the harder of the two, because I think Kantian ethics it's notoriously difficult when we have values that are in conflict. Again, the main things are, can I universalize this principle of action that I'm using for all cases? And then am I treating people as rational agents that are worthy of dignity? I think that the issue of resource allocation in the case of Kantian ethics is a lot more difficult to kind of parse out using those particular principles. Utilitarianism is really clear because we like Paul says, that we use those in triage situations and trying to figure out what the best outcomes would be for people who are involved. Yeah.
Olivia is asking, how do we apply these ethical principles to our current environment in which people genuinely believe misinformation about the consequences about COVID? In other words, if you genuinely believe that the costs of social distancing are greater than the costs of being infected with COVID, because the fake news is reported sort of inaccurate information about COVID, is it unethical to act in accordance with the mask naysayers, open the economy, open the schools crowd?
Genuine belief is no excuse. You can have genuine belief that is not reasonably well-founded. The genuine belief that needs to be respected is a belief that is backed up by some reasonable argument. And reasonable argument has to pay attention to the standards of truth. If people don't just form beliefs without any standards of truth, they have no right to that belief. Now, in areas where we don't have a standard of truth, take religious belief. There we can say, we don't have real standards for truth there. And so, of course, what you believe is your liberty, but whatever you want to believe, say, as long as it doesn't involve extreme militant religion, which kills other people, say. But on matters that we're talking about in COVID, you just do not have a right to your unfettered beliefs, independent of an reasonable attempt to discern the facts by some standards of truth.
I would also re-emphasize the argument about free riding, because I think falling back on things like fake news or beliefs that we want to believe because they're easier for us or more convenient or more consistent with the way that we want to lead our lives, I think is problematic for the fairness issues that Paul mentioned. So if I'm free riding, I'm gaining the benefits of other people's actions, whereas they're not benefiting from my actions. And when we're in a collective enterprise, like trying to survive a pandemic as a society together, it just seems that there's no way for us to be able to justify people's arguments from ignorance, whether they're willful or not. Because we are depending and relying on each other in order to do the right thing. And so we should actually try to make good faith efforts in trying to treat people well in this process.
Thanks. I may have a follow-up question to that afterwards, but for now we have a question from Penny. How does age, obesity, disabilities, etc., underlying conditions play into decision-making processes?
Well, there's a tremendous amount of unfairness here in the society because of structural inequities and in lack of access, as has been well described. First of all, people and take the essential workers in the society, including grocery stores, delivery, the whole category that we've carved out in policy here, where we say those people don't need to shelter in place, they can go work. The grocery store workers are a prime example. Many healthcare workers are the same, and they're not all just highly advantaged, well-paid people either at all. Look at nursing home workers. They need to be given some extra consideration here. The fundamental problem in the long run may be that people don't have equal access to the resources and the health care that is significant. And you can't, of course, do that overnight. You can't do that amid the pandemic, but you can make accommodation for that, what you might call that structural unfairness that's built into the situation already. And I think making those accommodations is very important. You might give them greater employment. You might actually give them some risk compensation benefit, for example. We haven't gotten to that point of considering that in society.
Sergia, is there anything you wanted to add before we go on to the next? Okay. So Micah asks, if someone wanted to be helped to die and they were suffering from COVID, then what would be the right course of action in regards to both utilitarianism and Kantian ethics? What would be the greater pain? The patient living on and suffering, or the potential loss of knowledge that could be recovered about COVID if the patient keeps living?
Assuming that there really is knowledge to be gained by the person continuing to live, there may not be. One can say, oh, we're going to find things out if we do. Is that factually well grounded or not? That's one element in the situation. Another element is just what people want to do with their remaining life. A person may, whether they've made an advance directive about the circumstances or not, should it be their choice about whether it's worth going on a respirator with the significant chance, once you get a certain level of illness in getting a respirator, there's a certain chance you'll never get off it and live. And there's also the chance that when you can get off it, you don't live very long at all. Given a person's judgment of those facts, and admittedly, they should understand what those facts are. What's wrong with a person saying, I don't want to take that chance? Because there's more suffering. It's not comfortable. It's not a good life being on a respirator. It's very uncomfortable. And some people say that quality of life, even if I can have another whatever number of weeks, months, maybe even years subsequent, it isn't worth it. My view is my life is complete enough now. I've had enough life. I want to help others by getting off by not using up one of the scarce respirators or whatever. And so let me die. What's wrong with that? Well, what would be wrong with it is we've pressured. Oh, you're 82. You shouldn't be willing to go on the respirator. That's what would be wrong with it. So the question is, how do you insulate people from the pressure? How do you really make sure we're not abusing people by pressure? And that's a big issue in the society. That's not easy necessarily.
I'd add, so it seems like there's a bunch of things going on in this question. So you could ask, is this person actually, have they submitted or authorized or assented to being a research subject? And that has a whole host of issues too about whether or not people can or should assent. And then also a question about whether or not somebody has a right to withdraw treatment. It also seems like there's an element in this too, as if like the person is using COVID as a means to express a wish that they already have or about their right to die. In which case, I think there would be other more humane maybe ways of proceeding with that rather than suffering from COVID willingly. But I think, the point that Paul made at the end about the issue of coercion or potential pressure that somebody would have to make certain kinds of life-ending decisions is important, particularly when people are ill, because we know that certain kinds of conditions or even being in a hospital or being in some kind of healthcare can alter the way we make decisions. And so there have to be a lot of safeguards to make sure that people are not being coerced in ways that are unfair and or inhumane.
So I think we have time for one more question from Grace. What about the cost of not going back to school versus the long-term effects of what students not being in school is and is going to cause?
That's simply a tough one. It's a real tough one. But the question, I think, is when I balance everything out there, the most important, the worst harm is probably, I'm not saying certainly, but probably if we don't get control of the pandemic. Because that makes a difference just in our own country of anywhere from 100,000 to maybe 200,000 or 300,000 lives. It really does. Now, how to get control of the pandemic then becomes sort of a factual question. Can you get control of it with a lot of very stringent measures, maybe very stringent, but just for 3 months, with gradual relaxation without the society getting nearly quickly tired of the restrictions? If you don't keep people out of school, maybe you can. There's some evidence now that school attendance for younger children, at least, run well. It takes real effort to do it. Some schools do it very well. Some schools don't do it very well. But for students in grades K through, say, 7 or 8, it depends on what under what conditions they're going back and under what rules.
I would add, so I think this is a hard question. I'm, as an educator who's dedicated my life to education and thinks that it has ultimate importance and value, and as a mom of 2 daughters that are in school, I get kind of the thrust of the question. But I think, you know, as an ethicist, if it means that we open schools up and 5 people die, 10 people die, 1,000 people die, 100,000 people die, I guess the question is, what is the tipping point? And for me, if somebody's grandparent dies or a parent dies or a cousin dies as a result of making these decisions, I think I don't think that there's a way for us to balance that out. Education is something that is ultimately important in my view. And I know that this is causing a lot of disruption, but it's very different than people losing lives. And so I don't think the scales here are equal.
Facts. Are more people going to die in the long run because they didn't get a good education for 2 to 3 years, if it really goes on that long? Because we didn't open the schools in modest and careful ways.
Well, that was, we don't have time, but that was the question I had, is just the question about fake news and the ethical consequences or not of making decisions based on what isn't true. And that's very related also to education. So we'll just leave it at that. It's going to be very exciting. In a couple of weeks, we'll be listening to our psychology colleagues talk about some of these same questions, but from a psychological behavioral perspective. So thank you so much for a great and very stimulating presentation. You realize how many of our daily decisions are just infused with these ethical questions. So thank you, Sergia and Paul.
Yes,
thank you
very much.
Thank all of you who attended.
Yeah. And we look forward to having you back next week when we'll be hearing from Professor Ami Shah, who's associate professor of global studies and anthropology, and she will be talking to us about the World Health Organization and the role of the global governance system and the WHO in the COVID pandemic. So thanks again to Professor Hay and Professor Menzel, and to all of you for being here this evening, and we'll see you next week.
Thank you. Bye.
Bye.